Hello, everybody. I'm Thomas Ledbetter. I hope you're having a good day whenever you're watching this. And I'm, of course, a student who is part of the Problem Identification and Intervention in Counseling 1 class, and I'm doing a presentation on autism spectrum disorders and neurodiversity. Now, this is part of a larger presentation on neurodevelopmental disorders proper, but since my part's going to be going last in the class and it might go over time and people might have to leave, I thought I might do a pre-recording with my PowerPoint and my own commentary and ideas in the hopes that it becomes a bit of a resource for people, if people want to look back on it, if they missed the rest of the last part and just want something to look back on for this subject. So without further ado, let's get on with it. So a little bit of a quick preface for everybody here. I'm going to introduce you to these people. Now you're probably asking me, Thomas, who the heck are these people? And why are they important? Why are you showing us all these faces? Well, this is actually specifically the DSM-5 work group for the category of neurodevelopmental disorders. And so they are the ones who craft and edit and revise the diagnostic criteria for autism spectrum disorders, as well as a bunch of other criteria under the label of neurodevelopmental disorders. And as you can see by what they look like, not too terribly diverse group of people, relatively old and, kind of mostly white leaning, if not very white. And so, but that's not the only thing that actually binds a lot of these individuals together. One of the big things is that the vast majority of these individuals, 10 out of the 14, specifically have MDs. And so their research and practice is very much connected into psychiatry, medicine, and psychopathology. So looking at things from very diagnostic and treatment lenses, rather than necessarily being involved in advocacy, partnership, and community building stuff. A lot of their research can be based in genetics for autism specifically, which then raises a question about how important looking at causes of autism and other of these disorders is necessarily helpful for these individuals and what that means, which we'll get to. And then some have other backgrounds in behavioral intervention and child development. Of course, they said most of them are white, with the exception of one person of color, and their degrees they got mostly between the 1970s and the 1990s. So part of the relatively old guard, have been around for a while and don't necessarily have the same kind of politics and understandings of things as we might have. But most importantly, there's no neurodiverse representation amongst this group. There are no autistic people, no people with ADHD within these communities who are getting to help decide and be on these panels to help figure out what these diagnostic criteria should be and what they mean. And I think that has a lot of implications as to the difficulties that a lot of individuals in these communities go through. And so I want you to keep this in the back of your head as we continue on and talk about this subject. So full disclosure, for those who somehow don't know already, I'm autistic. I was diagnosed very early on in my life and very luckily got a lot of resources and was able to now be among all of you wonderful people. And I've been studying autism and ideas related to autism advocacy and identity and socialization for the past probably 5 or 6 years now, ever since I was in my undergrad. But I also, just because I'm autistic doesn't mean I'm the only voice in the community. In fact, one of the most important things is that autism is a very, very heterogeneous diagnosis, that there are people from many different backgrounds, social worlds, race, gender, ethnicity, religion, socioeconomic status that all can fall under the label of being autistic. That's not actually really confined to a person and to a specific type of experience. It's incredibly varied. And so I thought instead of necessarily giving myself the floor immediately, I would give the floor to another wonderful autism advocate by the name of Amethyst Shaver, who does a channel called Ask An Autistic, where she goes through and talks about many different topics related to autism. But she also goes through she has a video specifically about what is autism and sort of helps lay some of the groundwork. And so I thought I might give her the floor a little bit and, let her speak about some of these aspects that are really important. So I'm going to pull up the video and mute myself, and hopefully you enjoy.
Hi everyone, I'm Amethyst, and this is the much anticipated episode of Ask an Autistic, What is Autism? Now, this is an absolutely massive topic, and I've actually been dreading this video a little bit because how do I do it justice in roughly 10 minutes? But you all have been waiting so patiently, and so I'm just gonna go for it. Autism is a pervasive neurological developmental condition that affects about 1% of human beings. To unpack that a little bit, pervasive means that autism affects pretty much every part of a person. Their personality, their experiences, their memories, how they grow up, how they communicate, and how they think and move. Basically, pervasive means that autism isn't something that just affects one part of a person. It's not something extra a person has tacked onto them, and it's also not something small that can be overlooked. Neurological indicates that autism has to do with the brain. Being autistic means that your brain functions differently. The structure of the brain may be different than non-autistic people's brains, and the different areas of the brain and how they talk to each other and work together may be different as well. Developmental indicates that autism begins before birth. When a little fetus is developing, it's either going to be neurotypical or neuroatypical. It's going to be autistic or allistic, and all that is determined very early. So autistic people are born autistic. Autism isn't something that can happen to you. It's not something you can catch, and contrary to what some would have you believe, it's not the result of things like heavy metal poisoning. And autism is not caused by vaccines. This isn't even something I will discuss because it's not a discussion, they just don't. Basically, a lot of people want to point fingers at what causes autism, but the truth is that autism is a naturally occurring variation in the human brain. And there have always been autistic people, it's just that we didn't recognize them as autistic. Autism isn't a disease, it's not something that you can catch or transmit. And it's not an illness. Autism isn't something that you can fix or cure. Autistic people are like people with Down syndrome. We are born autistic, and we'll live our lives autistic. And hopefully, with the help of our family and our friends and our loved ones, we can grow up into happy, healthy autistic people.
The thing I really want to make note of from that, two major things. The first of which being this idea of pervasiveness, that it's not something that can affect things in isolation. And the way that the criteria talks about it, it talks about things in senses of isolation. But autism is something that affects the entirety of the way you process your world and one's world. And it's really important to see that for a lot of people, that's the reason why it is seen as part of someone's identity, and why diagnosis, especially for adults, can be massively comforting for people, because it means that for them, they have an explanation and an understanding of why they feel the way they do, when all their life they've just been labeled as weird or strange or whatever, and they've never really known why they act the way they do. And now they have a community to belong to. And that's really important, that pervasiveness can be seen in a negative way, but in all reality, that can be also labeled in an identity way that is super positive for these individuals, because it's not something that affects you in isolation. The second piece of this is the idea of happiness, that each individual will have different conceptions of being happy, and parents and other people will have their own conceptions about what happiness is. And that's really, really important to see and to think about, because everyone's different definitions of autism and how they see that is going to affect exactly where each of these individuals come from and why people feel the way they do about whether autism should be remediated or not. And that kind of goes into a lot of things that we'll talk about later. But just to give people a bit of a primer, just to give a reminder about some of the autism stuff, we're not going to spend too much time on this. But the way the DSM categorizes autism, it sees it as a developmental and neurological difference that often persists early in life, even as early as 12 to 18 months old. For instance, I was diagnosed at 18 months. But despite this, many individuals tend to be diagnosed on average around 4 to 5 years old, according to the CDC, which is important because a lot of individuals who may present with more cognitive or language differences and difficulties may not get resources as much early on. And so after passing that critical language period, which is around 2.5 years old, it makes it much more difficult for them to be able to learn language in the same way that you and I maybe would. And so ASD is characterized especially by differences in social communication and interaction, which can manifest in a bunch of different ways. It can manifest in people approaching relationships and talking with people differently. For instance, I am very open about myself, about just the aspects of who I am and what I'm about, and that's not something, and that's kind of unusual to some degree. I'm very upfront just about a lot of different things that other people aren't as upfront about. This can manifest in differences of expression and interpretation of social cues and context, of just not, having differences in processing what the social context of a situation is. For instance, having differences in understanding what sarcasm is, understanding how that manifests there, and also even just expressing social cues like body language and the curvature of your voice, that is the inflection in your voice that's important for getting across social messages. Eye contact is another one. For me, I don't do a lot of eye contact normally. My eyes move around a lot, but that isn't necessarily because I'm not paying attention or being disrespectful. It's because if I'm focusing way too much on my eye contact behavior, then I'm focusing on that rather than the words and the ideas that are being said, where I'm having to focus so much on acting a certain way that I'm almost not getting the context of things, which we'll get to later. And this can affect turn taking and other typical social skills like reciprocity, and just the flow of how conversations happen is just maybe very different, which people in the research tend to attribute to this idea of deficits in theory of mind, of having difficulties with intent and understanding whether individuals what people's motivations are, why they feel the way they do, how they communicate, empathy. But that can get very complicated, as we'll get into, that the expression of those things, may be different from how someone internally understands things. And that can create these discrepancies in terms of how that happens and whether it actually is true that autistic people don't understand these things, and it is maybe just a different kind of expression. Another piece of this, though, is this idea of repetitive and restricted behaviors and interests, which also can vary wildly. You have differences potentially in speech patterns, a common one being echolalia, which is someone repeating a similar word or phrase over and over again. There's self-stimulatory behavior, what the community calls stimming, which stereotypically is things like flapping your hands or rocking back and forth or side to side. And even differences in sensory processing, where autistic people will be either potentially hypo or hypersensitive to certain stimuli, whether it be sound, smell, taste, visual cues, lots of things like that, and maybe even try to stimulate themselves through stimming in order to help give them sensory input or to help them concentrate on things too. And so this can often co-occur with other disorders, which obviously is not uncommon in the DSM. And so this can co-occur with things like language delays, intellectual disability, epilepsy, ADHD, OCD, anxiety, depression, and many more. It's not something that's isolated. It's pervasive. It affects the entirety of how you experience your world, as much as we can categorize it in this way. And while there are some areas like language and cognition that can be worked through with early intervention resources, especially between that 18 to 24-month-old period, the social and functional differences that bring about could persist very much in adolescence and adulthood. For instance, I very much am someone who, as much as I may make these PowerPoints and do all these different things, I have difficulty with things that to other people might seem very simple, whether it be going to the post office to mail packages, going to a store and asking and ordering food in front of somebody, going out and driving, things that are very mundane, are things that I might have my own difficulties with, and that's okay. And that's just due to defining what are those things and why do people have their own difficulties with them and how can they reconcile that. And that's a complicated and really tough process, especially when you're put into a mold of you should know how to do X thing and Y thing because you know how to do this, which is something I've been told many times. Like, well, if you were so smart, why don't you know how to socialize with people in these ways? And that's very complicated. And so there are many things we could potentially cover when we talk about ASD. The DSM goes into a lot of things, whether it be prevalence, prognosis, risk factors, treatment, a bunch of things. However, many of these are already covered in the DSM already, and they're easy to find in the research, so I'm not going to cover them as much. But the other piece is that the language for them tends to be couched very much in medicine and psychiatry, where we're talking about course of a prognosis or risk factors for someone getting it as if it is an illness, when it, to a lot of people, as we've talked about, is an identity, is a sense of belonging, that the ways in which autistic people might act might be different from other people, but they're not necessarily bad. They are just different ways of interacting that still can vary and have its own value. And so with such a focus on cause and treatment, it can be really tough to sort of weed through and figure that out. And going back to what Amethyst said earlier, we focus so much on this idea of causes and genetics that we end up overlooking the fact of how much of an identity this is for people, and that for individuals, it isn't something that necessarily needs to be cured in ways that many organizations, like for instance, Autism Speaks, tends to do. And so are really causes that important in the end of this? And should we really talk about autism as a disorder or a mental illness when it may not completely fall into that category? And so this creates a very difficult divide between a lot of different communities in terms of autism, because they're going to view autistic people and the understandings of autism very differently. A lot of ways you have families and researchers that in some ways see strengths, but also a lot of the times could work with autistic people who, let's say, didn't have early therapy for cognition and language, and so tend to see a lot more of the deficits in independent living skills and communication and behavior. That may not be because of the autism itself, but just due to the way in which people did not get the resources they needed because of other systemic issues. But even with that, they want to be able to help remediate those things to allow people to be happy in their own right. But that's also complicated to its own sense. And that's where the autistic community comes in, where they don't see their difficulties as because of inherent pieces of them, but due to societies that stigmatize, stereotype them, and don't give them the resources and accommodations they need. And so they don't see it as needing to be changed or cured. They want to be able to have those accommodations to allow them to thrive in ways that allow them to be happy, rather than what families and researchers who are not autistic making those decisions for them. And so this then brings us to what neurodiversity really is. And of course, Amethyst defines it beautifully, where it's the differences in brain development and how they affect functioning are natural variations in the human condition, in the human brain, and are not things necessarily to be stigmatized. And part of this comes from the fact that epistemic authority is often placed in the hands of neurotypical people, including like the DSM group, partly because of a belief that autistic people, because of how they socially view themselves, can't view their autism in a way that is objective. But then that begs the question, how objective is this science to begin with? How much should we look at things objectively in that way? And how much should there be a norm to begin with? And so because of those things, this is an attempt to take that kind of authority back for autistic individuals, as well as for other groups like those with ADHD. And so these differences can create a culture and identity around different forms of life, of just people having different senses of being, and the ways in which they communicate with each other are different, but they still have value in and of themselves. But even with that, one of the big criticisms is that this doesn't apply to people who are more lower functioning, or those who have high severity, high support needs, and that this is to deny the idea of disability. And that's not the case at all. It isn't that it's the idea that disabilities are not part of neurodiversity. It's the fact that the origin of the disabilities comes from an idea of discrimination and societal norms that try to say what is okay and what isn't about the way people should act, rather than the inherent aspects of a person. And as I said, doesn't just apply to people with who are low support or high functioning. As I said, that's a weird way to conceptualize things, because we could look at someone who's very high functioning in one area, but is low functioning in an area that you would think they'd be really, really good at, like the example I said earlier. And those individuals who maybe are even on the more high support end might benefit from things like alternative and augmented communication, like ASL or speech to text, or other kinds of devices that help them communicate in their own way. And so even if it's considered a natural variation, we still require resources and support. Now, one could beg the question, oh, if it's a disability or if it isn't a disability, then it's just a variation. But again, a lot of that comes from this idea of we have a system where we have to categorize individuals in certain ways in order to get them treatment and resources, rather than saying these are the resources that an individual needs in the first place to survive, regardless of label, let's give it to them. And so we have to push back to some degree to that kind of system, because in the end, don't we all deserve to have those kinds of resources for ourselves, whatever kinds of differences or struggles we might have? And so that's ultimately the point of neurodiversity, is to push back against that kind of systemic idea when it comes to the limited resources and when it comes to that discrimination and systemic oppression. And so this really much ties into a lot of the ideas we look at with diagnosis and the DSM. And a great example to demonstrate this, there's an organization called the Autism Self-Advocacy Network that does a ton of work when it comes to advocacy, and a lot of ways does talk through a lot of neurodiversity things and does a lot of advocacy for that. And in 2012, they proposed a bunch of changes to the criteria in the DSM, obviously before the DSM-5 came out. And so they were ones to advocate for that spectrum categorization to allow for more of that diversity and variety. But they also went and advocated for less strict adherence to the number of criteria autistic people had to meet in order to get diagnosis, as well as looking at criteria and tools that could take more into account coping mechanisms that might mask autistic traits, and more acknowledgement of how adolescents and adults might express autism in different ways. And the APA did do some of these things, but they mostly ignored the others. Now, one, again, could argue that by restricting the criteria, it might address that growing number of autism diagnoses, which has grown since the early 2000s from about, it used to be close to like 1 in 1,000 back in the 90s, and now the diagnosis rate is 1 in 54. Now, we could think, okay, that means there are more autistic people that are coming about, once again, the whole disease propagation idea. But it ignores the fact that growth may likely be due to greater awareness and access to understandings of neurodiversity and resources. And so why restrict the criteria in that kind of medical way, once again, in that sense of, oh, we need to make it to where we specify so that we give the resources to the people who need it, when it shouldn't be about that to begin with. And so this denies access to those resources for those who don't fit into a typical expression of autistic traits, which very much tie into issues of race, gender, and culture. And this leads us to one of probably the most well-known diagnostic instruments for autism, which is the ADOS, the Autism Diagnostic Observation Schedule. This was created in the 2000s by researcher Kathy Lord, and it's a tool that is an observational tool. You go in, you have a bunch of these codes and prompts, and you observe what a person does to see if they fit criteria for an autism diagnosis. And for the past 20 years, it's been considered the gold standard. But there are some confounds with it. Firstly, being that it's hard to know how much of the aspects observed are actual, once again, internal deficits in theory of mind, or just differences in how people process their social world and express social overtures. If I, let's say, have, if I don't present eye contact in the same way, and I use that as a way to express an idea, and it has the same function, and it gets to the same result, but it's different, I could be able to have an understanding internally of this thing and may not just express it in the same way, but that doesn't mean I don't understand this aspect of how a person functions. And in fact, in a different way, self-report measures, especially in adolescents and adults, can actually shed light on the internal aspects of autism that may be missed by mere observation, where autistic individuals may, and once again, stereotypically, may not present in the same way with autistic traits outwardly, but they can self-report and look at their autistic traits and see the ways in which they struggle with a lot of social situations and difficulties because of that part of their identity. Again, coming back to that epistemic authority. And there was even a story on a Reddit forum about autism from an individual who was really upset about, thinking about a diagnosis for weeks and going to a lot of resources to get evaluated. And they get given a bunch of diagnoses that aren't autism because of that restricted criteria, because they blended in too much and were good at carrying conversation and things like that. So they wouldn't be seen as autistic in that way, and how much it broke and devastated that person. When, as I said earlier, these are things about communities. These are communities that allow themselves to find a sense of belonging. And so you're limiting those resources that allow people to have that sense of closure and understanding by focusing just on the behavioral observations. The other piece of this that's confounding is that this is often normed on a specific subset of autistic individuals, which are usually white and male. But the social nature of a diagnosis, of having to deal with things and differences in social cues, will inherently change the expression based on many different aspects of being. For instance, autistic individuals who are female or who identify as other genders often go underdiagnosed or misdiagnosed completely, mostly due to potentially how autistic individuals will be, and women specifically, will be socialized to act in a very specific way as females versus boys, where that kind of expectation isn't as prevalent. And so they're almost giving inadvertent coping mechanisms that push them under the radar, because we're so used to, at least in American society, to tell women that they need to be socialized in a specific way and need to worry about being more social and outgoing, rather than not really giving that expectation to men. And alongside that, there are also racial disparities in diagnosis that are common, because, of course, culture is going to affect social understanding and how forward or not forward people are. And so that can conflate in a lot of ways. And there's a lack of acknowledgement of intersectionality when, as I said, there are a lot of people with different autism diagnoses of many different ilks, once again, racially, gender-wise, sexuality, lots of different pieces. And another thing I want to make note of is that Kathy Lord is actually one of the people who is on the board for the DSM work group that we mentioned earlier, which you would think, well, she's an autism expert. This is what she does. She does the diagnosis. And not to throw her under the bus, but couldn't there be some degree in where she can help mold the criteria to fit the instruments that she's already created, rather than looking at the diagnosis on its own terms and then being able to then craft instruments that make sense given that diagnosis? I feel like that kind of compromises the validity to some degree, especially when the tools that are being used are not normed on as many individuals who are of different racial and gender backgrounds. And so it really pulls into question whether the diagnostic criteria and the diagnostic tools are really representative of autistic individuals in general. Even with that, though, even with that notion of diagnosis, let's say regardless of that, there isn't any kind of widely accepted medication for treating autistic individuals, though many are diagnosed later and medicated anyway, which of course we've gotten into the implications of what happens when you medicate people with psychotropic medications who are young, 4, 5, 6 years old, who have these kinds of differences, and what the implications of that are can be kind of scary. But there are also some behavioral measures that can be used and techniques that are used for autism treatment, the gold standard being that of applied behavior analysis, which in very short terms is basically a form of conditioning that rewards and tries to extinguish specific behaviors via reinforcement, where it's basically saying, you did this good thing, here's a reward, okay, we're going to give you a reward if you do this thing differently, basically. And this can be seen as very effective in autism, especially in the language and cognitive domains mentioned earlier, which might actually be helpful for allowing individuals to communicate and gain more opportunities being in an ableistic society. But there are many criticisms with this line of treatment. The main one being that these are often used in ways to limit behaviors that are not harmful but are seen as autistic, where the social aspects of trying to act in a certain way or prescribe to do conversations in this way tends to be redirected to make for conversations that tend to fit more of an ableistic mold of social understanding. Of just, this is how a conversation should go and you act this way because this is how you get by in the society, rather than having people be authentic to their own identities. And a lot of autistic adults will often see this treatment as traumatic and will report that even with proper training, behavior analysts end up being punitive towards them if the behavior is not followed through on, which once again kind of a terrifying notion when we think about this as an identity and trying to push people to be something different that isn't in their nature. A good example of this, actually, to demonstrate it, is this idea of stimming. Once again, I've mentioned stimming a few times. And stimming in a lot of the literature is cited as being associated with difficulties in concentration and learning. Hence, there's a need for remediation. And it seems to make sense on the surface of, okay, this individual, if they're moving their hands around or doing all these things, then they're paying attention to that and not to the thing that's actually happening. But firstly, much of this research emphasizes stigma for parents and the overall society, and people, like, let's say, looking around and seeing this individual doing something that's weird and strange and how embarrassing that is for the parents. And they emphasize that as much as they do the whole learning goals. But the second piece, and to me the more damning one, is that autistic people often see that stimming as a coping mechanism rather than as a detriment. That it's a way to help them work through overload, sensory overload, and differences in processing. Where individuals are agitated or very excited and they're feeling a lot of those sensory pieces come up and their senses get heightened, it allows them almost to excise that energy. I have that a lot of the time. And often it may even be a tool for social expression if different stims can actually be linked to certain moods, where I can have a specific stim for being excited or anxious. And that can be very complicated to parse out, but it's important to know that that is a reality for people. To give a great example from different piece than autism, I have a friend who has ADHD who told me about how they would fidget a lot in class and they would move around in different ways, and the professor would think that they're not paying attention or they're being weird or they're just concentrating on that. And then they show up to office hours and they have these immaculate notes, and the professor's like, how do you have these notes? I didn't think you were paying attention. And going back to what I said earlier about eye contact, they said to the professor, if I'm focusing so much on trying not to stim or trying not to fidget, then I'm going to be putting my attention on that and not the actual knowledge that's happening. I need to naturally do what makes sense to me in order for me to actually concentrate and take information in. And so the question then becomes, why should we change this behavior? What is ultimately harmful about this beyond that it is different? And that becomes the consistent pattern with ABA and these social domains. They're often rooted in these deficit models that are consistent with that biomedical DSM categorization approach, and it can uproot people's feelings of being able to be autonomous, to exercise their agency, and being true and authentic to themselves. Case in point, social camouflaging. Now, even with all these things taken into consideration, and even if accounted for, a lot of autistic people still feel a stigma towards their own autism, that there are certain stereotypes that come with being autistic, whether it being seen as dangerous or violent in the case of with the self-injurious behaviors or things, or even mundane things like being aloof or detached from people or non-empathetic. And then if autistic people can express themselves in ways like, for instance, I can, people push back against them and see that you're not really autistic, or if you were so good at this, why can't you do this thing? Rather than accepting that each of these individuals have different skills for different reasons and that there's so much more variation. And so because of this stigma, a lot of individuals will socially camouflage, which basically means they prescribe themselves a set of rules or scripts. Either they memorize or mimic people, they observe, they even go and sort of deduce rules in their head, maybe saying, okay, if someone says this thing in this way, it means this, in order to pass as being allistic or typically developing. But this process has two shortcomings in that it can be incredibly exhausting, since it can take a significant amount of executive functioning, because think about it. Imagine having to take all of the things that you know socially for granted and having to think about them every time that you speak to someone. It can be exhausting. But then secondly, on that note, there's so much variation in how individual interaction happens that being able to take that into account in a prescribed rule set way is so rigid that it can't take into account enough, and it breaks down very quickly. And so this often becomes a no-win scenario for a lot of these individuals, where even if they have pride in their identity and community, they feel like they have a fear of rejection or denial if they disclose, where either their identity isn't understood or people see them as autistic and then reject them, or they camouflage in ways that are draining. And then, as I said, because they can't account for all the social stimuli and because of how varied every interaction is, those things break down, which results in them being found out as autistic anyway and rejected regardless, which is very complicated. Even for me, I sometimes do that as well in my own way, where I will make my self-monitoring very obvious and try to make it up front in the hopes that people understand and don't reject me. And I do that because I want to be proud of my autism, but I still get scared of it from time to time. And it is a really complicated sort of process. And so where does that then eventually lead us? All of this coming together, what is the results of all this for autistic people? And there are many different outcomes that can happen from this. Many autistic people, as we've said, can get diagnosed too late and may not get medicated, or may end up getting medicated and don't get, let's say, early intervention resources that then target language. And so that passes that language period. They don't get the development and the skills they need. And so these individuals end up not being able to be in general ed as much and are often segregated in the special ed classrooms without peer interaction with other non-autistic individuals, which obviously they can be happy in their own way. And that's wonderful. And that's all that really matters. But that limits their opportunity to have an open future, to be able to decide and have the capacity to really see for themselves what they want to be, which, we want that for any one of the children and people that we work with. The second piece is that others sometimes don't get diagnosed at all, where they're either misdiagnosed and don't get resources, or individuals like, as I mentioned, females who are socialized into acting in a socially prescribed way end up passing as ableistic, but then still deal with many of the internal aspects of identity and social issues and are denied that identity clinically, as we've talked about. And even with a good diagnosis and intervention, problems can still persist. And I know this because I was on both sides of it. I was nonverbal when I was diagnosed, and I worked, my family worked very hard to get me a lot of resources. And once I got into the system, it became a constant, is he still autistic? Is he still autistic? If he doesn't have these goals, we have to take this away. Is he autistic enough? And really that battle of, you have to be autistic enough to get those resources. But then there's these feelings of stigma and inauthenticity due to people then feeling like they have to mask their autism to stay in the world and gain opportunities in an ableistic society. And so this culminates in this idea that there's a lack of supports for autistic adults, but importantly, we have a trajectory and an idea in our heads of what autism should be. That autistic people are diagnosed and have a lot of these issues early on, and then we remediate them, and then they're not autistic anymore. And therefore, we stigmatize people both for being too normal to be seen as autistic at the early end, but as they go on, try to stigmatize them for being too autistic rather than being normal. And this then culminates in that idea that all of this is rooted in a biomedical and deficit understanding, an ableist understanding, where these individuals are not given access to resources to integrate if they're not autistic enough, or they're told to act ableistic in order to integrate if they're seen as too autistic. It becomes a no-win scenario where it's not about prescribing people to be who they are and letting people be the best they could be. It's prescribing people to act in certain ways towards a norm and have to constantly either fight for resources or to get resources, but then be stigmatized for the sake of those, which then makes it nigh impossible, or at the very least incredibly difficult, for many autistic adults to find their own autonomy in the current systems we have. So what can we do from here? Because there's a lot here that we can talk about and lots of things that are important. And I don't want to come across as being cynical or being fatalistic, because that's not what this is about. This is about pointing these ideas out so that people can be aware and can continue to understand and hopefully make systems better. And so what can we do? I would say, especially for mental health and counseling individuals, if you have your ear to people in these positions and supervisors, consulting with autistic people in communities, learning about their wants and needs, and really taking that into heart with advocacy that you do. helping try to increase resources for things like early screening and intervention to allow more of the cognitive deficits to be worked through, which also aren't necessarily a fault of autism, but may just be kind of a weird consequence. And there's some research tying into how the social processing differences might impact language. And so not to stigmatize autistic people for having them, but being able to give them resources to where they can have, once again, that open future. And for nonverbal folks, giving them more access and allowing for more funding and opportunities for things like alternative and augmented communication, whether it be visual schedules, speech to text, ASL, stuff I mentioned earlier. And then there's this idea again of then revising the criteria and the tools to allow for autistic people in different backgrounds to receive that label and resources. And I think importantly, bringing more autistic voices into the research field, but by changing the culture of research to include them, which is very big and complicated. But it's important because being in psychology means we are given a certain pedagogical mindset. We are told this is how you look at problems, this is how you understand things, and we socially prescribe people to act in certain ways and to talk in certain ways in order to be insiders in the field. That's why we've learned the terms and why we want to understand to begin with. But by doing that, you're pushing autistic people to act and conform in certain ways that might not be true to their identity and the people that they want to help to begin with. And so we have to allow people to be authentic to those things, to represent outsiders in the community and still be accepted within the research field, because that is how progress gets made. And that's how we allow the voices who should have the epistemic authority to have that authority, rather than people who don't have the lived experiences like those in the work group. And also, again, for mental health people, and I'm mentioning school counseling stuff in a bit, but I'm trying to kind of split up a little bit if I can. Things for if you're doing diagnosis and evaluation, especially for older adults, being accepting of autistic people's self-reports and giving the benefit of the doubt regarding identity. I think we talk sometimes about this idea of like you want to kind of assess objectively, but these are individuals who have their own identities and their own understandings, and I think they feel very unheard a lot of the times. And so I think being able to understand that and take those in is incredibly important to do. And I think, is part of the job. It's part of when you're working with autistic people and understanding their experiences. And then if you're working with, let's say, younger folks who are just getting diagnosed, who are, let's say, like infants or whatever, trying talking with parents and helping give supports about what works and what doesn't, but also being positive when presenting the child and they're struggling, where it isn't about, okay, they're going to have all these difficulties throughout the rest of their lives. It's they may have these struggles, but it's our job to do what we can to help, and in giving parents hope. And I think sometimes people can conflate that hopefulness with naivety. And I don't think that's right. And I think that is remiss of these parents and these autistic individuals and their experiences, because you could teach parents to give up and not get the things they need when they could in all reality get the resources they need for their children and have their children be able to live the lives that they deserve to live for themselves. And then being accepting of the differences in social expressions, especially when doing therapy, that these individuals might stim, they might have special interests they talk about. Oh God, special interests. I know, because I have a lot of them, and I haven't even covered special interest. Even just the idea of like being very quote unquote hyper fixated on a certain thing. Autism's kind of one of my own. And that can make people super excited, and people have different forms of conversation that make sense to them. And being adaptable to that can be great, because it allows them to embrace their own enthusiasm, their own joy, and their own identity, which is incredibly powerful for these people. While these are guidelines and these are many different aspects, these don't all have easy answers, because every individual is different, and you always have to know there's a person in front of you rather than a diagnosis. And it sounds obvious to say that, but it's true. These are aspects that I think we can get too caught up in the weeds of diagnosis without seeing that there is a person in front of us who has their own empathy and understanding. And I think that's something we always need to keep in the back of our minds and remind ourselves of. And so a lot of things, especially for with educational folks in school counseling, a lot of stuff that can be done can work through in terms of advocacy and parent partnership, where you can be an advocate for parents or autistic adults to help them get resources, whether it be at a committee of special education meeting, or in terms of when you're working with individuals with their individualized education programs, things like that. And this is obviously hard because authorities or higher ups may push back on this because they don't want to give money and funding, because as we've established, this is a system in where people have to fight for resources because it's about this idea of you either have a disability or we won't give you the things that you need, but then you get stigmatized for even having it. And so being a liaison for these parents and for these individuals and helping them feel heard and supported is deeply, deeply important. And then lastly, I keep mentioning school counseling a little bit because I do come from that background a little bit. But if there are policies and practices or attitudes that are negatively impacting these individuals, and this is the case in anything, but I'm going to mention autism specifically here, speak out about it. And, as I said, I've talked about a lot of these negative things, but it doesn't mean there isn't reason to have hope, where with the right kind of supports and with friends and family and good people, we can have people who can live the happiest lives that they can live on their own terms as autistic people. But we have to push change in systems and not give up in doing that. Even if people might look at us and think that we're being naive or that we are pushing against systems that we can never change, that doesn't mean it isn't worthwhile to do it. And so talking about it can be really hard to do when that authority has the final say, and there may be a hesitation in compromising relationships with coworkers and people, because that's hard to do when you're standing up towards people who are part of these bureaucratic systems. But changing this culture is really important for the children you're working with, especially for children who already have a disadvantage in that system. So speak out. Don't take no for an answer. If someone needs a resource and isn't getting it because of money or because there's this belief of if we give it to this kid, we have to give it to all these other kids, don't take that. Keep pushing back on that and keep going with everything you have, because this is a person's life in your hands. It's part of the job, and it's part of the reason why we're here. And these are individuals whose futures are depending on you and all of us. And it's a responsibility that is important to take on, and it takes courage to take on. But I think each of us in our own value is deeply, deeply worth that. But also take care of yourself too as best you can, but also push back against these systems and don't let anyone deny you the ability to have that hope that those systems can change. And don't get disillusioned and keep going. Just keep going. So thank you for listening to this gargantuan presentation and for a wonderful semester. It's December when I'm filming this, so if you're not watching it then, don't worry about it. But for those who are in December, enjoy your holiday, enjoy the end of the semester. You deserve it, and take care of yourselves in the meantime. And hopefully, whether you have a next semester here or not, I hope you take care of yourself. So thank you for listening, and have a wonderful rest of your day.